if you just happen to be a child of the 90s, grew up back in the 90s and listening to music, well, that one there coming up to you from John Cicada, Just Another Day, right here on TRAXXfm. It is TRAXXfm Momentum, second hour of the show, and it's a new, different days, different themes from Mondays right up till Thursdays. And today, well, Monday, the 25th of November, it is Health on Traxx. Stay tuned. We have our guest in the studio. Very interesting topic, especially when you come to sports. But we have picked a particular sport which is trending here in the country, or I should say around the world, pickleball. And yes, how do you take care of your foot and ankle? All that, much more on Health on Traxx. Stay tuned. Welcome back to the show. Hi there. Very good morning. It's my producer, Zam, together with myself here, Gilbert, with you on Momentum, second hour of the show. It is Health on Traxx. Different days, different themes, as I said earlier on. Now, if you would like to catch us on our social media platform, you could do so. We are on TikTok and YouTube. That's TRAXXfm Official. TRAXXfm Official, and on Facebook it is TRAXXfm. So get on board together with us right here on the show. Now, as I said, pickleball rapidly gaining popularity in Malaysia and attracting growing interest and participation from individuals of all ages. And while the fitness levels, I should say, can be intensifying for a certain part of your body, it doesn't matter which age category that you're in. And well, pickleball, just to give you a little, overlook on this, a blend of tennis, badminton and table tennis. Yes. Okay, I haven't played pickleball. I don't know about you, but talking to our guest in the studio is going to be a very interesting topic on this particular sport and how do you take care of certain parts of your body, especially when it comes to foot and ankle. Now, just to let you know that pickleball offers enjoyment and numerous benefit. And it is important to take care, particularly to prevent injuries, minor sprains and bruises, and even fractures. And to address this particular concerns, we will be speaking to our guest in the studio, orthopedic surgeon from Prince Court Medical Center. And we will be talking to surgeon Dr. Yeap Juan, who is specializing in foot and ankle surgery. And very interesting topic, so keep it locked in right here on TRAXXfm. And if you'd like to probably ask a little questions, you could do so on our Facebook page, TRAXXfm. A very, very good morning to you, Doctor. How are you, Doctor?
Good morning, Gilbert.
All right.
Happy to be here.
Nice to be here. And Doctor, do you play pickleball or do you play tennis?
I'm more of a tennis player, but I do have some pickleball bats at home.
Okay.
And when it's raining outside, yeah, you can play pickleball in the house.
Oh, that's new. That's something nice, but making sure that you do not have valuable items in the house, especially when the kids get a little excited, and that's it. It's a smash. Not only on the ball, but on maybe something else in the house, right?
You're right.
Okay, so I will be addressing Dr. Yeap here as a doctor. And Doctor, could you just tell us a little bit more about yourself and the profession or the particular area that you specialize in when it comes to foot and ankle?
Right. I think everybody is familiar with orthopedic surgery.
Yes.
Basically, we are looking at bones and joints.
Mm-hmm.
And particularly in the orthopedic field, we branch out into subspecialty.
Okay.
And foot and ankle surgery is one of the newest subspecialty in the past 10 years.
All right.
It's been growing all over the world. And currently in Malaysia, we even have probably around more than 30 foot and ankle trained subspecialists.
Okay.
And so we deal more with the ankle, with the foot.
Mm-hmm.
If you looked at Malaysian healthcare years ago, the foot was actually neglected. So people, with deformities and pain in the foot just had to bear with it. And now we are able to do something more about that.
Okay. And all right, so now we're getting into our topic for today, Doctor. Could you tell us that what are some of the most common foot and ankle injuries associated with playing pickleball? Or probably if you could elaborate a little bit more on this common problems.
Right. So Pickleball, if you have played it, you would know that there's a lot of movement, front and back,
Yeah.
side to side.
Okay.
So usually the problem happens is that when you play on a court which is sticky, which most of the pickleball courts are, they tend to have their own specialized courts, or they take over badminton courts or tennis courts,
Right.
and you have sticky shoes.
Okay.
So what happens if your foot is planted and you move fast, then you're liable to twist your ankle. And
Okay.
that probably is the most common ankle injury in pickleball.
Okay.
And when you twist your ankle, if you are aware of it, you can sort of not put your full weight transfer on the foot that is being twisted. So you just drop to the floor, and then hopefully it's a minor sprain.
Okay.
The problem is if you are a bit slow to react and your foot is planted and the ankle rolls. And depending on how much the ankle rolls, you can break the ring that holds the ankle, and then you can get a ligament tear, you can get a fracture. Worst case scenario, you can get ligament tear plus fracture plus a dislocation.
Okay.
Right. So if your whole body weight is on that leg.
Okay. Just to let our listeners know why we have picked this particular topic, because pickleball is actually something or a sport that's been played by the youngsters and also the more senior players. Okay, so that's why we are talking about this particular topic, because most of the other sports I don't see much of the senior players getting involved, but pickleball seems to be picking up its trend here in the country. And Doctor here is explaining to us about how important is it to take care of your foot and ankle, especially when you're playing pickleball. Most of the courts have been, redesigned, or probably some of them are not even redesigned. It's just been transformed into from tennis to pickleball. And this is where when you move around the court, probably with not the right shoes or anything like that, you can have a fracture on your ankle or on your foot. So Doctor is explaining to us on how to take care of this particular part of your body, especially when you're into this particular sport. And Doctor, pickleball requires quick movement, as you explained just now. Yes, and how do you move on the court and things like that, which can put a strain on your feet and ankle. Now, what about the older players? How do they manage these demands to reduce the risk of foot and ankle injuries before you get into the court?
Right. I think if you look at the history of pickleball, from tennis, there was a movement many years ago. In fact, pickleball has been around for quite some time.
Right.
It is especially big in the US versus the other tennis offshoot, which is called paddle tennis, which is more popular in Europe, Northern Europe especially.
Okay.
So pickleball in the US is famous, and probably it's in the media, like you remember Chandler Bing from Friends?
Oh, okay.
Yeah,
okay.
so he was playing pickleball before
Okay.
he passed away, and
Right.
and yeah. So they have the yearly World Championships, I think, in Florida. And Florida is a very nice, warm place where you, how shall I put it? Where a lot of seniors go there to retire because the winters are not so bad.
Okay.
So the yearly World Championships are usually there. So that's why it's very popular among the seniors.
Right.
And if you look at the courts, it is smaller than a
right.
tennis court.
Okay.
So for the seniors who can't run, it is good for them. And in the sense, if you look at the similarities between, I would say pickleball is like playing table tennis on a big court without a table.
All right.
So with a
right.
bigger ball. So
Okay.
it's easy to see for the seniors. Okay?
Oh, okay.
And then you don't have to swing so hard.
All right.
And the ball doesn't move as fast as a badminton shuttlecock or even a ping pong ball.
Yes.
So you're able to get it.
Okay.
Right?
All right.
Yeah. So when seniors play that, it's easy for them. But having said that, there are certain issues that can come to injury.
Okay.
Because if you look at the stance that they stand, they stand in a crouch position.
Okay.
So sometimes you can even get knee issues, back issues. You can strain your back muscles. You can even pull your knee muscles.
Okay.
Okay, and you can also twist your knee.
All right.
But as I said earlier, the most common is foot injuries.
Foot injuries.
So when you have all these factors in, courts are expensive to book. They're hard to book.
All right.
And most people always think that when you come to court, you straight away play because you want to maximize your time on the court.
All right.
So that is probably a misconception which you need to correct. You need to come to the court earlier, maybe half an hour to 15 minutes earlier, and you need to do stretching and you need to warm up.
Okay.
And all that will reduce your risk of injury.
Right. That's actually how the warm-up is done. Before?
Yeah. So before, when you get on the court, of course you must be well dressed for it. Although if you look at most pickleball courts now, it is more of a social gathering. You have these young ladies who are dressed to kill. You've got men, macho, wearing singlets, showing off biceps and things like that. So when that's probably a different subset, but you must make sure you have the proper shoes, you got a proper attire, you don't, so that you can move around on the court.
Okay.
Yeah. So when you get on the court, before you get on the court, you need to stretch.
All right.
And stretches are important for upper limbs, stretching your wrists, your elbows, your shoulders. Maybe not so much of the shoulders, less overhead movement. Then you need to stretch your back. You need to stretch your calves, your hamstrings. You can do circles around your ankle. That all helps to loosen up the joints.
Okay.
Make sure it's ready to
get into action.
Okay. Yeah. And then after you do your stretching, then you've got to do warm-ups. And the thing is, if you look at a pickleball area, it's a social thing. You've got cafes there, you've got small areas to put your things, and then a very small area to walk around,
Okay.
So you don't really have a very big area to warm up actually, but you need to warm up. Yeah. So small things you can warm up. You can do jumping jacks, you can run on the spot, you can skip, you can do side to side shuffles. You can
very
your
important
hips and all that. Yeah. So all these are the things where if you say your game is booked at 10 o'clock, you come at 10 o'clock, you probably will not be doing this. And then you run the risk of injury.
Okay. So well explained by Doctor here. Doctor, now you did explain about the youngsters, they some of them even wear makeup and things like that. Okay. And control and show off their biceps. Like the one in Transformers, biceps. Okay, anyway, but what about, can someone play pickleball, or whoever is playing pickleball, who has ankle arthritis? And what should players at this particular situation do? Do they have any symptoms? Do they, is it healthy for them, first of all, to get on the court and play? Or is there a special warm-up for it?
Interesting you brought this up, Gilbert. Because a lot of people have this thinking that if you have arthritis, if you have wear and tear of the joints already, then you should not wear it out more by being active. That's actually another misconception. Joints are made to be mobile. And if you have someone who has arthritis, if it's early stage arthritis, being active in sports, be it pickleball or any other sports, is actually good because you mobilize the joint, you strengthen the muscles around the joint, and that actually slows down the arthritis. So, people always think when you do a lot of sports, as long as you do sports, you don't get injured, you actually have a very long lifespan.
Okay.
We do surgery for end stage arthritis, like for example knee replacements, ankle replacements, ankle fusions.
Right.
You'd be surprised. It's not the hardcore sportsmen that end up getting replaced. It's not like the world class athlete. They've worn out their joints through a lifetime of abuse and things like that. No, it's the little old ladies who were never active and things like that. So it is not something where if you have arthritis, no, you should not. You should be active. So in answering your question, when they have arthritis, the usual things, as I mentioned earlier, should apply, meaning stretching,
All right.
warm
Warming
up,
Yes.
okay, and then going to game.
Okay.
The other thing that may help is probably using an external guard, meaning like an ankle guard
Okay.
or a knee guard, something to help tighten up the joint and reduce the risk of
Friction.
an extra movement. If
okay.
let's say there's too much movement, then they may get more pain with the arthritis.
Okay.
Yeah, but
Okay.
you can be active with arthritis
All
depending
right.
on how bad it is.
So don't let arthritis stop you from your routine sports activities.
Yeah, you never know. I mean, if I can stretch your thinking a bit, okay.
All right. All right.
You always think that like for instance, heart disease is one of the main killers, all right, in our population,
Okay.
and you don't link that to arthritis, but you should, because if you have arthritis and then you end up being sedentary, and then you don't exercise, your heart gets weaker. Your heart gets weaker, you get more lifestyle diseases like diabetes and things like that.
Right.
And that will all predispose you to getting a heart attack earlier and dying earlier.
Right.
So
Chain reaction or something
yes,
like that.
it's a cause and effect, but you need to see the whole big picture and the long-term effects. So if you have arthritis, you need to be active. You're not active, you'll probably get a heart attack and you probably won't last as long.
Okay.
Yeah. So it's not your joint will die before you. Your heart will give up before your
on
joint.
you.
Yes.
All right. So there you go. Don't let these kind of things stop you from being active, especially in sports. But watch what you're doing. It depends on your age. It depends on the condition of your foot and probably the knees. Don't push it too much, and that's what any doctor who will advise you on that. What we're going to do right here is take a short break, and when we come back, we'll be talking to Dr. Moore on the little issues that probably you face, or probably what should you do before you get into the court. And we are talking about this particular sport, which is pickleball. Thank you so much for joining us on the show. We are live on TikTok, YouTube, that's TRAXXfm official, and on our Facebook page, it's TRAXXfm. So get on board. And yes, our topic, staying safe on the court, preventing and managing pickleball injuries. Stay tuned. This is TRAXXfm Momentum. back to the show. Big Yellow Fury, Big Mountain right here, TRAXXfm. Hi there, and a very good morning. It's a build up to midday news coming up in 17 minutes. And we are still in our topic today, Health on Traxx, Momentum. Today's edition, the 25th of November, talking to our guest in the studio and Dr. Yeap Juan, who is an orthopedic surgeon, foot and ankle surgery at the Prince Court Medical Center. And today we have picked this particular topic, especially with this rapidly growing sport, pickleball, and the injuries that probably you can pick up, especially on your foot and ankle. How do you prevent it? What are the other issues that you need to know before getting on the court? All that, much more, spoken by Doctor himself. Getting back to the questions, Doctor, welcome back to the show. Thank you so much for being here with us. Doctor, getting into our question right here. Now, for new players who are picking up a pedal for the first time, what are some essential practices or techniques to minimize the risk of foot and ankle injuries? Just to let our listeners know who probably just got on board, especially for sports, your ankle and injuries and things like that. Could you elaborate a little bit more, Doctor, on this?
All right, thank you, Gilbert. Yeah, like any other sport, when you go into a sport for the first time,
okay,
your body is not accustomed to that sport. All right, so repetitive strain injuries are very common, especially when you start playing. You get very worked up. The adrenaline flows. You are very, you feel like you want to play more. And then the first time you go and play, you play 3 hours. That's it. That is a recipe for disaster. You can get tendinitis, muscle strains, muscle aches, and things like that. Right. So everything you must do in moderation. You start slow, okay? So apart from the stretching, the warm-ups and things like that, so when you start the game, okay, make sure you don't overdo it. If you play, you book the court, you play for an hour, make sure you take breaks in between, you hydrate well, and then in between, when if let's say as we mentioned, yes, a social game, so there may be many people involved on one court, so there may be down times where you resting for half an hour or an hour. So again, before you get back to playing, again, you can do a light warm up again, maybe not for 15 minutes, but for 5 minutes before your second game and things like that.
Okay.
And if you get, if you want to reduce the chances of repetitive injuries, you should not be doing this like morning you play, evening you play, the next day you play, next day afternoon you play, and then you will get tendinitis.
Right.
Yeah. Okay. So if you play, and it's important to have rest days.
Right.
It's important to cross train. Okay. If you are playing this game seriously, not so much on a social basis, but you want to take it seriously, you need to cross train. So meaning, like, for instance, Monday you play pickleball. Tuesday, you can go for a run, you can go for a swim, you can bike, you can go to the gym.
Okay.
Then Wednesday, you play pickleball again, and therefore you activate different parts of your body, use different muscles, so you don't overuse a single part of your body.
That's how important it is. Listeners, I hope you're listening in to this. Doctor, how can players recognize the early signs of foot and ankle injuries, when you've already picked it up?
Okay, generally speaking, if it's a muscle soreness and you have no injury during the game, the moment you finish the game, you feel sore, you go back, you sleep, the next day you should be well. Okay? If you're not so, and then you go and play again, and then that soreness or pain persists, then it may be the signs that you're getting an injury. Okay? So usually a body functions very well. You rest a couple of days, then everything goes back to normal.
The healing process happens.
Yes.
Okay.
Yes.
First thing is, do not exert yourself too much. If you haven't done the sport at all, don't push it too much. Stretching is very important. And then warming up is also very important. So these are the three things that probably should be on top of our mind before we get into any sport. And we are talking about pickleball, which is trending in the country. Doctor, what are the most effective rehabilitation techniques for therapy or on common foot and ankle injuries, especially from pickleball? And how long does the recovery typically takes place?
Sorry, Gilbert. You mentioned those 4 things. One more thing I'd like to add, which I mentioned earlier,
Okay.
cross training.
Yes.
Yeah.
So there are 4. Okay.
Yes. Okay.
So it's don't push the sport too much.
Yeah.
Or whatever sports that you're involved in, warming up, stretching, warming up, and cross training is what you said. So do not go extremely on that particular sport. Give some time for the muscles to relax. Try picking up something else. Swimming, I think, would be a little bit more practical, as your muscles are not so strained there. Doctor, this question here: most effective rehabilitation techniques.
Right. So for the ankle, if you have sprained your ankle,
Okay.
there will be swelling,
Okay.
there will be pain. You may find it difficult to walk.
Uh-huh.
So that's when you have this strategy. We call it RICE or PRICE, which stands for PRICE, which is protection, rest, ice, compression, and elevation. So if after you get an ankle sprain, you should be doing this. Okay, you don't have to straight away come and see the doctor and things like that. They will probably just tell you the same thing.
Okay.
You may take some anti-inflammatories to reduce swelling and inflammation.
Okay.
And then you ice it, and then you do all these rests. So once you have no pain, the swelling will slowly come down.
Okay.
And then you're mentioning about rehabilitation techniques.
Right.
So rehabilitation techniques for the ankle consists of a few things. One of the main things, when you twist your ankle, you stretch the ligament or you tear the ligament.
Okay.
And the ankle ligaments, they function very well in balance. So, so one way of rehabilitation is actually to balance, to do your balance exercises for your ankle. And a simple way to do that will be to stand on one foot. Make sure you have some support nearby, you don't fall down.
Okay.
And then you balance on that ankle which is injured for 30 seconds, for instance.
Do you put weight on it, doctor?
Yes, you stand on one foot. You stand on the injured foot.
Okay.
Yes.
Okay.
And that helps what we call ankle proprioception. And if you find that you can balance like that, no issues. You can make it more difficult. You can close your eyes, for instance, and balance on that foot.
Okay.
Or you can put a pillow on the floor and you stand on the pillow to balance. And nowadays, with a lot of sports outlets near am I allowed to mention outlets? Yeah, not the name.
Sports outlets.
Sports outlets. Yeah,
that will do.
Yeah. They sell balance boards. Okay, they have balance boards or balance balls, where it's like a half inflated ball, spherical, which is on the ground, and you stand on that rubber ball or the balance board to balance. Of course, then the other thing is to strengthen your ankle. And how to strengthen it is, you have all those Terra bands, those exercise bands.
Right, yes.
Where you can push against resistance.
Okay.
And then you can do that for your ankle and concentrate on the side-to-side pushing.
Nice.
And upwards pushing.
Okay. Off the question here, doctor. What about the weights that you have on your ankle? Some of them wear weights.
Ankle weights.
Ankle weights. Is that okay? To strengthen your ankle area.
It's ankle weights are more towards strengthening the knees and the hips.
Oh.
Because if you look at it, you put the ankle, the weights above the ankle, actually.
Yes.
So it doesn't actually strengthen the ankle per se.
But the knee is taken. Yeah,
correct.
Okay.
Yeah. So if you want to strengthen the ankle, you should strap the ankle weights on the foot.
Oh yeah.
Then
but I haven't. Yeah. You can do that?
You can do that.
Oh, okay. I'm going to do that, try. Okay.
Yeah.
Well, whenever I train or I run, I always have very tight knee guards. I'm talking about the ones not that you put it on, but the ones that you strap on. Because that one gives you either you want it to be tighter or a little bit more looser.
Yep.
So that's my preferred choice, keeping those knees intact. Mom was a runner, and I see the after effects of her. She used to run during the 80s, 70s. Yeah, so I've seen the after effect. Both her kneecaps have been replaced.
Right.
So, yeah, having good shoes is important. Warming up, stretching, things like that, and also the guards. Yeah, very important, doctor.
Yep.
All right, just one final question here, doctor. Are there any specific preventive measures or adjustments that players with previous injuries should consider when returning to the game?
Right.
If you're talking about, we were talking off air about tennis just now. Yannick Sinner, Rafael Nadal, the injuries that they have. Well, what about this one here, doctor?
Yeah, well, speaking of those players,
Uh-huh.
they are world-class athletes. They have access to rehabilitation, to physical therapy every day, a
Right.
couple of hours a day. So normal people may not have access to
Those,
that.
yeah.
Yeah. So if you're coming back from an injury, of course, it's best if you have a chance to go to rehabilitation or physical therapy,
Okay.
and then do a course of that.
Right.
Okay, and then if there's no more swelling, no more pain,
All right.
and you're returning to game, again, go back to what we mentioned earlier, all the stretching, warm-ups, and things like that.
Okay.
And in addition to that, what you mentioned, like having a guard, an external device,
Yes.
okay, like an ankle guard, one which you can strap. There are many different grades out there. They have those with the side supports even. If you follow tennis, you see Andy Murray used to have this. In fact, Yannick Sinner wears ankle guards in every game. You can see that his ankles are a little bit more bulky. So those actually help
Right.
prevent inversion or eversion injuries, ankle sprains.
Right, there you go. Very important, all this. So always prepare yourself well before you get on to some action. All right.
Yep.
Thank you so much, Doctor. Thank you. It's something that is very, very knowledgeable, very informative, especially for those of you who are into sports. But we were talking about this particular sport which is trending here in the country, pickleball. But I think Doctor is more into tennis, right?
Yes, Gilbert. Thanks.
Okay, just to break that a little bit here. Thank you so much for joining us on the show, talking to Dr. Yeap Juan, who's the orthopedic surgeon, foot and ankle surgery, Prince Court Medical Center. Thank you so much, Doctor.
Thank you, Gilbert.
And to our listeners, guys, whatever you do, stay safe out there. Thank you so much for joining us on our TikTok platform, YouTube, and also on Facebook. My producer, Zam, together with myself here, Gilbert. It's a build up to the midday news. Back right after that. Stay tuned.